Welcome viewers. Hello, my name is Adrian Kowalski and I am a registered respiratory therapist with a neonatal pediatric specialty at a children's hospital in Orlando, Florida. Today I'll be reviewing the mustache taping endotracheal tube technique that my hospital uses in the neonatal, pediatric, and pediatric cardiac ICU. In this video, it will just be me retaping the tube, but we practice 2 people should be at bedside, rather it being 2 RTs or a RN and RT while retaping tubes. The supplies to have ready is a bag and mask, spare pieces of tape, alcohol wipes to remove the tape currently on the patient, protective skin barrier wipes to help the tape stick to the patient's face, and transparent dressing films to place at the end of the tape, 1 on each cheek to keep the tape from removing from the patient's face. I will also suggest to the MD or APRN that's working that night to place a sedation and or paralytic one-time PRN dose to help ensure that the patient doesn't move while retaping the tube. The RT that is assisting me, I usually have them hold the tube while retaping, but in this instance, I'll be the one holding the tube. So the first step is I verify with the RT that's helping me to make sure that they have a good grip on the tube. Then I'll take an alcohol swab and wipe the patient's face while removing the tape. And also, I would also clean the cheeks to make sure that the cheeks are cleaned off. And I still have a good grip on the tube. And then again, wiping the cheek where the tape was to make sure it's clean. And then I will also wipe off the upper lip to make sure that that's clean from the adhesive from the tape. Okay. And then I usually will do this to let it dry. And then the next step I'll do is I'll take the protective skin barrier wipe, which is called All Care, and wipe it on the patient's cheek and upper lip to make sure that the tape that we're going to place on the upper lip and cheeks stick nicely to the patient's face. Then this also needs a few seconds to dry in the patient properly. Okay, and then I'll test it to make sure it's nice and sticky, and that means that it's nice and dry. And then the next one, I'll take my first piece of tape, and a personal preference, you can start on either side of the cheek. It doesn't matter because you're going to be taping the tube the same way when you start on both sides. Alright, so I take my first piece of tape. Okay. And then I'll start on this side, since it's the easier side, and you want to just lay it nicely flat on the cheek. Don't stretch it yet. And then nicely on the upper lip, ensuring before you wrap the tape around the tube, making sure that you're not pinching or squeezing the upper lip. And then you start wrapping around, and then this is when you'll stretch your tape to make sure that it's nicely tight around the tube. And then you'll wrap it around like this 2 times. And then you'll place this tape right here. And not stretching it on the other cheek. Okay. Does that look okay? And then you take your second piece of tape, and then you want to make sure, since you already started on one side of the cheek, that you start this piece of tape on the opposite side of the cheek. So then again, you place it the same way you used the first one, place it on the other cheek, and then taping it And then once you get here, you start stretching it around the tape to make sure it's nice and tight around the tube. Good. Okay. Yeah. So then this is when I'll pinch it extra right here to make sure it's nice and tight around the tube. And then I'll also verify that none of the lip, as you can tell, is seen. It's not pinching or squeezing in the tape. And then usually I'll take one more piece, which is called the mustache piece. It should be your shortest piece of tape. And then this is considered the mustache tape piece. And then you'll place this on the upper lip, just overlapping right on top of the other pieces of tape. Good. And then next, what you'll do is you'll take the transparent film, you'll place one on one side of the cheek at the ends of the tape to make sure that the tape doesn't come off of the patient's face. And then also when you're doing this, depending on how big the patient's cheeks are, you want to make sure you don't get in their hair or in their eyes. Like that. Good. And once that's on, I'll take my stethoscope, make sure I'm listening to the breath sounds, making sure I still have bilateral breath sounds. I'll check the patient's vitals and ventilator settings to make sure they're within normal limits. And then once completed, I'll have the RN or come at bedside to make sure that the tube is still in the proper placement from where we started. And then I'll also inform her if I saw any skin breakdown when taking the prior tape off. And thank you for taking the time to watch this educational video.